disabilities and the implications for supporting individuals with these co-occurring conditions. Our learning objectives for today's session: we'd like participants to be able to describe behavioral signs and symptoms of anxiety in adults with intellectual and developmental disabilities, describe how biological, social, and environmental factors can impact anxiety, and describe ways to support a client identify and communicate their symptoms and seek treatment. Lastly, we'd like you to be able to identify basic coping skills to prevent and decrease anxiety. At this time, I invite Andrea and Connie to lead our presentation for today.
Started talking and no one could hear me. Thanks, Andrew, and thanks everybody for joining us today to talk about anxiety. Already went over the objectives. Just want to spend a little bit of time. Why is it important to have this understanding of mental health and all those pieces, and not telling you guys anything you don't know about the increased risk and the increased rate of mental health conditions in individuals with IDD. But I think it's important for us to realize the risk factors that lead to that increased risk. So we know that individuals with IDD can have a higher likelihood of having stressful family experiences, experiencing stigma, abuse, neglect, unemployment, decreased lack of determination in their lives, and decrease or lack of supportive friendships. All of these things can lead to these increased risks in anyone. And when you have lots of these, it leads to a higher risk, which is what we see in folks with IDD, and why it's so important to be on the lookout and understand what we can do to help support those in our lives. So we know this with IDD in general, it could be as many as 60% of adults and as many as 50% of children. Autism also has a higher rate of mental health conditions in general. And when we look at what the most frequent ones reported are, anxiety, which is this generalized anxiety disorder, GAD, is one of the highest, kind of right up there with major depressive disorder and ADHD. We add in social phobia with GAD, other types of anxiety, and it really is one of the most significant and impairing things when we talk to adults with ID that they are telling us they experience. So when we say anxiety, everybody has anxiety. It's actually part of what keeps us alive, right? We keep moving towards the things that we need, whether it's food or shelter, because we're worried we aren't going to get them. But it becomes disordered when it starts to interfere in our lives in significant ways. So when we talk about anxiety disorders, it's this group of things such as generalized anxiety disorder. I think of this as wide range of worries. This is worrying about everything all the time is the way to look at it. I think this little pressure cooker icon right here on the left is a great example of it. It's just always there's some type of worry, whether it's about a storm that's coming up or whether it's about who's going to be showing up at my house in a little bit. Is there going to be someone that I don't want coming in my house? I have a dentist appointment in 3 weeks. I'm worrying about it. It's all of these worries that can really interfere with folks. Something like a social phobia or social anxiety disorder is really related to those social situations. So the one that we most often think about is performance anxiety, which a lot of us maybe have at certain points, standing up in front on a stage and having this level of anxiety. You'll see that in folks with social anxiety disorder, but that same level of anxiety that you might get if you stand up in front of a stage, they may get when they walk into this restaurant that's here in this center picture. It might be the idea of standing next to people. It might be the idea of talking to them, eating in front of them, things that others may take as just normal, common things. Doing in front of other people becomes a very anxiety-provoking thing. Then we think about things like panic disorder. So this could be something that can look like a physiological, a heart attack, breathing, lightheadedness, head spinning, but it's really related to this panic attack that can seemingly come out of the blue when there's not a true, true thing right in front of them to trigger it. as well as specific phobias like things like needles. So that's kind of like that textbook, what we think of. Well, what does this look like in individuals with IDD? Really, a lot of the same stuff, but sometimes it might look a little different, or they might voice it a little bit different. When we look at the research, what we see is some general indicators are fear of unusual situations. So that might be something where you have someone who's getting very, very fearful in situations that are unusual to get fearful in. So yes, you might get fearful in a haunted house, but are you getting fearful when you just walk into the mall or the grocery store? And this idea of just seeming to be nervous, so this physiological nervousness. So these are the first symptoms you may see in someone. Again, just these symptoms, every once in a while, everybody gets these. It's when we look at this as our first kind of indicator, and then we look at the next level. And this is really diving deep into the physical symptoms of anxiety. So when we look at this, we can see things like difficulty falling asleep or staying asleep. They might be on edge, fidgety, restless. So sometimes people will think, oh, that's ADHD, or oh, that's just their intellectual disability. They're a fidgety person. But you'll see that they just can't quite relax. And it's really about this anxiety piece rather than it be overactivity associated with like an ADHD. They might be shaky. So you might see some tremors or shivering, their teeth chatter, excessive sweating. So often you'll see these and they tend to kind of hold together, and you'll start to notice them kind of occurring together. Yet again, we might all have difficulty sleeping every once in a while, but we're having difficulty while we're also edgy and fidgety, all of these things. These are the red flags, excuse me, that something else might be going on. Other things, someone who just says, I'm afraid, I'm afraid, I'm afraid. And there maybe they can't vocalize what it is, but they feel those physiological symptoms and they're able to voice that they're afraid. Shouting, like excessive shouting can be another one. Someone who tries to escape, withdraw, or freeze in an unfamiliar setting, that can be another sign of anxiety. Another one that I think we often don't think about is irritability. Think you often may find and think about that person that withdraws, but some folks may be a little bit aggressive, and it's because they're so wound so tight. Think about my little pressure cooker picture here. See her? She looks irritable. If you're worried and you feel so pressure filled, you can get to this point that you're feeling irritable, and that may come off as shouting at others or snapping at others, all of these things. So just one of these may not be an indicator, but when you start to see a bunch of them together, that's when it might be time to just start paying attention a little bit more. And sometimes you can pick up on what we call these cognitive symptoms or the thinking symptoms. It depends on the person's level of expressive language, but you'll hear it, like I said, excessive worry. So this is excessive more than other people around them. It's persistent, it doesn't go away, and it's unreasonable. It's about something that shouldn't be worried about. So worrying about something coming up in the future. Well, if I'm having a major surgery, that is maybe not excessive or unreasonable to worry about. If I am going to my day program that I've been going to for years, but I am worried about the ride there excessively, and I'm talking about it a lot, or I'm worried about who's going to be there, or I'm worried about going to see my friends this weekend, and it's all of this going over and over again. That's when you think that. Worrying about mistakes. So often they make a mistake, someone corrects them about it, and they just keep talking about it. They're worried about it. They keep bringing it up and over again. You can worry about their loved ones. Are they okay? Are they okay? Like checking on them, wanting to be near them, kind of some of that clinginess. Excessive worrying about storms is another good indicator. Someone who just gets very anxious in storms and thinks, what else is going on that they're worried about? And then we already talked a little bit about those social situations. So you start to hear people talking about those as well. This is when we start to think there's something going on here. This person is really showing anxiety. I like this visual because this just kind of throws it all in here together for us. So we think about these symptoms, but chronic fatigue even. So that could be the other one. It might be that they can't fall asleep, but they might just be like, I'm tired, I'm tired, I'm tired all the time. Muscle tension. So they're tight. They're not concentrating. They're irritable. They're edgy. They're restless. And then they're having these worries that are excessive, persistent, and unreasonable. I want to look at this, and then we want to look at how long it's been going on. This is the other piece, is thinking about how long has this been going on. If it's significant, this is when we should start to look into it. One of the things I want to pause here and think about is something called diagnostic overshadowing. Whole idea of diagnostic overshadowing is that we want to take a check on our own biases. So one of our biases might be, well, they're just repeating that over and over again because they have autism and they repeat things all the time. That's when we start to attribute something to the disorder or to the disability, and not understanding that it could be a symptom of a mental health condition. So this whole idea of diagnostic overshadowing that everyone that works with people with IDD needs to think about is, just because someone has a developmental disability doesn't mean they're always going to be anxious, doesn't mean they're always going to have trouble sleeping or be irritable. This might be a tendency to just kind of say, oh, that's just part of their disability. But we want to look at it if it's excessive, persistent, and unreasonable, and has this cluster of symptoms. We need to think about it beyond just this is part of the disability. It's something that we've seen over and over again in literature with providers, clinicians, everyone, is this tendency to think, well, it's just part of the disability, we shouldn't seek help for them. So just something I'd like you to think about throughout the course of this lecture, or this didactic today and our cases, but going forward, is making sure, am I looking at this through a fresh lens, thinking of mental health, instead of just lumping everything into, oh, this is part of disability. The other thing we need to think about is, well, we talked about the different cognitive symptoms. You have to think about communication difficulties. So sometimes folks can have difficulty interpreting their own and reporting on their internal states. They may just agree with you all of the time. They may not have the language to tell you about those worries. And so what do? We watch for some changes in behavior. Like I said, looking at those clusters of symptoms around anxiety. Listen to the individual. Yes, they may not be able to say, hey, Jane, I am very worried about storms and about something bad happening to my mom and about this. But if they're asking repetitive questions about those pieces, that can help us. Tracking those moods and what that looks like. Are we seeing patterns with this and their behavior, where they're having trouble sleeping and they're tense and they're tired all the time, but we know they slept? Really being able to look at this. And then once we get all this data, we can take it to the individual's primary care physician, help to work with case coordinators, supervisors, to say, hey, I think this might be something we should look into for this individual. When we do this, I also want everybody to think about, when something new comes up, we want to think of it through this lens where, yes, down at the bottom is this idea of the psychiatric disorder. Is this a mental health condition? We also want to think about other things that are going on with the individual as we're starting to take that data and get things in place. So we want to think, this acronym I love is called HELP. Health, environment, lived experience, and is it a psychiatric disorder? So we want to think about medical conditions. We want to look at things like hearing. Has their hearing been assessed? Do they have an ear infection, GI distress, preamps? Some of these things, all of these medical conditions can sometimes change behavior that can also sometimes look like a psychiatric disorder, whether it be anxiety or depression. If you're having ear infections, you're irritable, you might be on edge, your stomach's upset, you may not want to do things. Dental, you're not feeling good, so maybe you're tense and having difficulty sleeping. So we really want to think about these health conditions as well. We want to think about the environmental situations going on. If someone's asking repetitive questions about who's going to show up, has there been a staff change such that we need to like help them understand that? Are there appropriate expectations, or are they worried about going to their work site because they're asking them to do too much at the work site and they don't understand it? And if they're having some social difficulties, do they have social connections with folks that can help them feel connected and be engaged in social situations? We want to think about lived experiences. So that's where it kind of is tracking the data. Everybody can maybe have blips where they feel like this, especially if something has happened in their lives. So if there's been a death or a separation from a family member, a change in roommates, and also trauma. This is something we'll hit on a few other times, but I think when we're looking at it as a psychiatric disorder, we first want to understand what might have led to that. And trauma can be something that needs to be addressed in the moment to help the person, but then also as we think about diagnosis and treatment. And we know that people with IDD are at risk of having more adverse childhood experiences and experience more abuse and neglect than the general population. In fact, they're 4 times more likely to be a victim of a crime and 3.4 times to be neglected. So we need to think, has there been something recent that's happened? Some type of traumatic experience, something from their childhood that maybe is being triggered right now. We'll dive into that more deeply in this future session, but definitely as we're thinking about how are we approaching this individual to understand what's going on with them on this road to helping to support them in their mental health. That's a lot. That's a lot to take on. And I think that's where it's starting to think about all of the different parts of our acronym here when you're collecting the data, so that when you go to the health provider, you can be able to think about that and just to be able to start to think about it. So what we want to think about is, okay, so we've gone through this list, helped to provide supports. We're still seeing these significant symptoms of anxiety. We can help to look at these changes in behavior through our data, be supportive. If the individual is asking for help, support the individual, and of course, assisting with transportation. What we've often found in the research is, in addition to helping to get the person to treatment, is that direct support professionals can be incredibly helpful when it comes to supporting the individual in therapy. So if the individual consents, sometimes providers can come into therapy sessions and help get coping strategies and other things. And then they can also help provide practice on the outside. And I think that's another important piece. I kind of skipped over it, but therapy can be really helpful for adults with intellectual and developmental disabilities. We may often think, oh, it's just medicine. Well, kind of that same diagnostic overshadowing with diagnosing can have a treatment, but they say, oh, they have an intellectual disability. Psychotherapy, therapy, talk therapy, relaxation stuff, that's not going to help them. We just need to get them medicine, but that's not true. We know that there are a lot of strategies that can be incredibly helpful to help those who are experiencing significant anxiety. So helping support while the person is learning them and having them practice, helping to do and support them to get to therapy are huge roles that DSPs can help. The other thing that you can do is to help them either in the moment or to prevent anxiety. It's like we said, everyone gets anxious, and it's helping to let that pressure out that helps everybody relax and leads to less really significant anxiety that can build and build. And so there are a lot of ways that you can help in these little bits, just one by modeling in yourselves when you're getting anxious or when you're feeling upset, is saying, I feel my heart is starting to beat because I'm getting worried about this appointment I have to go to later. So I'm going to take some deep breaths. It does take a little bit of getting maybe a little bit vulnerable, I guess, or letting things out. And maybe it's more just I'm worried about, the weather later, so I'm going to take some deep breaths now. There's some great apps that you can model using the Calm app on the phone or Headspace. Insight Timer is another great app that has a lot of relaxation, breathing and visualization. And I've heard from a number of adults with intellectual disability that they really enjoy having those types of meditations that can help them. And it really is just taking that time to teach them how to do it. That might be the other thing is you may have some things that when I get upset, this is how I calm myself down. So even just saying, I take 3 deep breaths when I'm getting upset about stuff, why don't we practice now? Or hey, let's listen to this app together. Hey, let's check out this Calm app together. You have to be in the right moment. Often the time to not do it is when the person is up at a level 10, right? That's probably not the time. Think about yourself. If you're up at a level 10 and someone says, just breathe, how's that going to go over? Not well, likely. But when you're like, hey, we're all a little edgy. I think we just need to do a little thing on my Calm app and just make it this non-threatening, non-thing that you can help to do. I'm going to show you a few of them. And I think it's good for all of us. I know that I benefit from, we've been digging deep into anxiety treatments. And so I've started trying some of these breathing techniques and they're fabulous. I did them, ironically, my daughter was super anxious about tryouts and she was like giving me her eye rolls and was not enthused about this whatsoever. And I walked her through it. She's like, oh, mom. So I think it's just a matter of trying them yourselves and doing that. So let me walk you through them, a few of them and practice them, and then we'll be ready for questions. The first one I really like is easy. This is one we talked to adults with ID. This is one of their favorites. It's just something called equal breathing. Super easy. So I'm going to ask you guys to play along with me. And we're going to breathe in for a count of 6. So breathe in, 1, 2, 3, 4, 5, 6. Breathe out. 1, 2, 3, 4, 5, 6. Let's do it one more time. Breathe in. 2, 3, 4, 5, 6. Breathe out. 2, 3, 4, 5, 6. Okay, how do you guys feel? In the chat, did it help at all? Ooh. Feel a little bit calmer, calm. It is good. Calm, centered focus. Yeah, it doesn't take much, but it stopped. Even me, I didn't do the breathing, but I walked you through it, right? I've been going through at my breakneck speed on all of my slides. And it's just something that just pauses everyone. And it's super, like, it's a simple thing. It's not, huge rocket science that we need to do, but it helps. The other one, I don't know, how am I doing on time, Andrew? I'm always terrible on time. Do I have time to do one more?
We have time for one more.
Awesome. All right. Here's another one that's a little bit longer, but I think it's something that works more on what we call mindfulness. It's called the soles of the feet. So this is something you can Google scripts on how to do this, but there's been a lot of research with folks with autism and IDD that this idea that by concentrating on your feet, it can help to control urges to be physically or verbally aggressive. It can help to stop the thoughts, those anxious thoughts. So what we can work with folks to do is when they start to feel themselves getting frustrated, is to just do this. So what we do is I'm going to walk you guys through it. If you're standing, stand in a natural rather than an aggressive posture. If you're sitting, sit comfortably with the soles of your feet flat on the floor. Breathe naturally, do nothing. Okay. Want you to think of a time you might have been a little angry. Things were flowing through your mind. You're getting grumpy about stuff. Let them flow. You may start to feel yourself get a little tense. Now, I want you to shift all of your attention to the soles of your feet, to the bottom of your feet. Slowly move your toes. Feel your shoes covering your feet. Feel the texture of your socks or hose, your sandal. Feel the curve of your arch, the heel of your feet against the back of your shoes. If you don't have shoes on, feel the floor or the carpet with the bottoms of your feet. Keep breathing naturally and focus on the soles of your feet until you feel calm. Okay, and this is something we can practice, but it shifts thinking from that incident to your feet. Something as simple as that. It doesn't have to be, that's a script. Like I said, I put this on here. These are little, I screenshotted all the different types of YouTube videos that can walk you through this for yourself. Try that first for the individual that you work with. But just mindfulness, thinking about things we see in the environment, like bringing someone's attention to what do you see out there? How many cars are out there? And that can help to bring people back into the here and now if they're getting upset. All right. Well, thank you for listening to our talk on anxiety. I'd love to take time for comments. It looks like there was a bunch of stuff in the chat that I was not paying attention to. So I don't know if there's any questions there as well, but I'll pause for questions.
Yeah, I'd like to invite everyone to ask any questions that you might have or share those questions in the chat. Yeah, people were referencing the equal breathing or the focus on breathing was really helpful, feeling calm. Other people
I
are
have something to share. You have to think also that there are differences when somebody may have a pre-existing condition like seizure disorder or the cerebral palsy / muscle spasticity than say only anxiety. Now they can go together because people are anxious or nervous because that's acting, but sometimes the first thing of the physical disorder is the lead to the anxiety, just to let you all know.
Yeah, thanks, Christine. Those are really good points. So someone may be kind of spastic or tight, and that might just be part of their normal baseline due to other diagnoses. So it is a lot of times it's that change from normal. But yeah, those physical symptoms can often be those first signs that you can see. And that might also be a great time to start to label. Oh, I feel myself getting tense. It looks like you might be a little tense too. This would sure be a good time for us to do that equal breathing. Or remember, I saw someone talk about how the Navy SEALs do box breathing. So it can kind of say, like, remember how I saw you those Navy SEALs do box breathing? Why don't we try that? And just trying to catch at that point is a really good point. Yeah, and I think you're right. Sometimes that breathe in, breathe out for that long is too long for folks. I know some of our folks with IDD said, well, I get a little panic because I have asthma. So just finding maybe it's breathing in for 3, pause, breathe out for 3. So the breathe in, the hold, breathe out, hold. Sometimes that doesn't work for some folks. So just trying some of the other ones again when they're calm to see which ones might work the best for them can be helpful. Yeah, and I see, Christine, you also talked about body scanning, which is another great thing to do. And those are things you can find online, where it's just looking, like thinking about all the parts of your body and calming them down. A lot of things that are just what we think of as natural calming, techniques that everyone uses can be very helpful for folks with ID. It's not going to replace treatment, but it's something that we can do to maybe help in the moment. The other part of this that I think is the most important is to talk to the individual. What works for them? So if they are in therapy, they may have a coping plan. So they may know that the body scan and box breathing are great for them. And they may be like, no, I hate box breathing. They've tried that with me 12 times. If you say it again to me, I'm going to throw something at you. So you want to make sure that we're asking things in a way that they will like it too. Well, I was hearing about this app. Do you want to check it out with me? You know, what do you think? Or is there something we can put in your plan or that's in your plan that can be helpful? So really asking them what helps them, and encouraging them. And I think I love this. You guys are often, you're saying, oh, this helped me, this helped me. So I think that's the other part, is modeling it so that they can see different things. So someone else said music. Listening to music might be the way that the client calms down. So there are a lot of ways that we can work on kind of relieving some of that pressure throughout the day for them.
Yeah, thanks, Andrea. I think, one of the big takeaways for me is sometimes things that are perceived as quote unquote problem behaviors, or things that we often ascribe to the developmental disability and characteristics of that, can be red flags of these underlying co-occurring psychiatric disorders that individuals just may not be able to express and communicate. And there were some others sharing stories about some underlying medical conditions with sinus pressure, similar to the example that you gave with an ear infection that was causing this person to engage in behaviors that were out of their normal behavior, and that led to some additional issues for them. So keeping that in mind as professionals in the field. And the other big thing was knowing that you're an advocate and a champion when working with individuals who may need that type of support for communication. On another project, we've developed a toolkit that provides some best practices in that realm of mental health therapy, as well as a guide for adults with intellectual disability to go through to prepare for communication or with a therapist or another medical professional. And this is the types of tools that you may be able to work with your client on, and filling that out and talking through some preparation for a medical appointment, while also using some of these other tools that we talked about today. Are there any other questions or comments that anyone would like to share? Yeah, and finally, Chris makes a point. I think Andrea had mentioned, this isn't necessarily treating the anxiety, right? These are coping mechanisms and techniques for calming and regaining focus, and sometimes can be more preventative or in the heat of the moment, calming down. Right,
Yeah,
there are issues that still need to be worked through and addressed with a
and
medical.
that's why pulling in those professionals is so important, right? Is that just doing breathing techniques isn't getting at the underlying cause of the thoughts or those other issues. So I wanted to give you strategies to take, but also understanding that, we want to get folks linked with the psychological and psychiatric care that they need, that they can really make a more targeted plan for the individual. Yeah, thanks for bringing that up.
That's right. Yeah. And we've seen a lot of literature on more specific techniques like cognitive behavioral therapy that really gets at, more of a treatment plan for working with individuals. Well, thanks everybody. At this time, I'd like to shift gears and move to our